All right, so Mr. Carey, right?
Yeah, care.
Carey. All right, so just so the board knows, we met last week at the medical center, and we had talked about options for the medical center, and I just expressed my feeling to the fact that I think any municipality, we'd be fortunate to have an employer like Lawwell Hospital in their community. So I think, you know, we should follow up on that. And Mr. Kerr is going to be talking about our options, or what the options are and how we got to where we are. So go ahead.
All right, is this present from here?
Yeah, you're fine.
Yeah, okay.
No, you're fine.
Well, thank you. My name is Jerry Kerr. I'm the chief executive at Lewis County General Hospital. Shortly, I'm approaching my 2nd year anniversary, and so have spent a lot of time in the first 2 years kind of reorganizing, addressing capital issues, recruitment issues, and kind of getting to know Lewis County. I come here from the state of Maine, so I'm not native to the North Country. So what I wanted to, have an opportunity is give you a sense for where we are with the Copenhagen Health Center. And so I was appreciative that Ken had some time, and we included Ron Burns, your legislator, and also invited Ryan Pichet, the county manager, just to be transparent. And I appreciate Ken's reflections on Lewis County General Hospital. We are the county's largest employer. We're one of 3 municipal hospitals left in the state of New York, which is another way of saying we are the public's hospital. And so we have an obligation, I think, to communicate when your communities are directly impacted by the things that we are doing. In our most recent economic impact study, shows that our economic impact to Lewis County is right now $114 million annually, and we employ just shy of 700 people. And through our health insurance for our employees and dependents, we cover over 3,000 lives. So, we're an important resource. So, right now the Copenhagen Health Center is closed, and we do not have a provider. And I wanted Ken and the others to understand how that occurred, and that's why I'm here tonight. So I've actually written out so I can stay focused and hopefully not ramble, and so I'll be looking down at it, but it's really to give you the information, and then at any point if you have questions, feel free to interrupt. So I put together a timeline to help make sense of how we arrived at the current situation. That look back helps me anyways to understand what is rather than place blame. Because if you can understand how we got here, it allows you to drive a solution. There is a certain element of it is what it is, and that is true here. And there's a famous football coach in New England who is fond of saying, what we can control is our performance and our execution. And that's what we're going to focus on. And being a Patriots fan, yeah.
Good man.
But I think what the coach is saying, we got to look at what's in front of us. You respect history for what it is, but what are we going to do to get there? So we must understand that. We must understand how we got here, but not dwell on what was or was not done in 1993, 2006, 14, 15, or 16. And that's really why I'm here tonight. I think you deserve to understand how we got here, but then we got to get to what are we going to do so we can be the healthcare provider in Copenhagen. So the current situation is LCGH has not had a license to operate an Article 28 clinic in Copenhagen since July of 2006.
Oh.
Yeah, that was my reaction the day that I found that out. That is what is, okay? In the files, I was able to find documentation going back to the early 1990s, specifically 1993. And what I learned is the greater Copenhagen community has had a number of physicians, both private and employed by the hospital over the last 26 years. And within that time frame included 2 periods where there was no physician coverage at all. So if the people of the community are confused about access to health care, it's clear to understand how and why.
Good way to put it. Confused at what's going on.
Exactly right. So, in May of this year, the hospital received notification from DOH that the Copenhagen site is operating at a level of primary care and not providing only limited services. It does not qualify as a part-time clinic site. Lewis County General Hospital will need to file a certificate of need application to establish the clinic as an extension clinic. So this is classic bureaucracy and regulations. What it means is our presence in the community has been part-time, and we know that to mean not a full-time doctor, right? Dr. Scott, your most recent doctor, was here 2 days a week. And a lot of that was driven by, I think, this perception that there was not enough business in Copenhagen to have a full-time doctor. I believe there's enough population and need that we could have a full-time clinic. And full-time in today's medical world means 4 days a week. Okay, so I believe if we had stability in the provider, the doctor or the nurse practitioner, we would see increased activity at Copenhagen Health Center. So on top of all of this, it wasn't really a great month, the month of May. In addition to a lot of rain, we learned that the clinic wasn't licensed. Dr. Scott retired, and the nurse practitioner we had earmarked to be your full-time provider. And what we had thought would happen is she would go 2 days, very quickly get to 3, and then we would grow to 4. So that was our plan. We recruited her last fall. She came from the western part of the U.S., and I was doing a great job. Was working both in Lowville and spending some time here with Dr. Scott. She had a family emergency and had to make the decision to go back west. So she had to leave. Clearly, we respected that, you know, family first, and then you have your day job. So this was the timeline, and I'm not going to go through the entire timeline, but I want to really highlight the key periods. So in July of 2006, the CEO at that time received a notice from the Department of Health that the license renewal for the clinic is denied. The reason it was denied is the doctor at that time was in private practice there, and you can only have one. The department is not going to approve the hospital to bill from that clinic site if there's a private doctor at that site. And I think that's what added to some of this confusion. We had periods where the hospital ran the clinic, and then we had periods where there was a private provider. And it kind of went off and on like that for 25 years. So what I think was happening at that time is the doctor at that time was wanting to be employed by the hospital. So the hospital applied for the license renewal. However, the doctor was still private and hadn't given up his license to run that clinic. So there was a bit of a timing issue. With that said, the doctor remained private up to about 2010, and then became employed by the hospital, and the hospital started billing for his services because now he was an employee of the hospital. But at no point did the hospital ever have the license for the clinic. So it went on, time marches on.
And we sold the clinic to the
Right, to the
hospital
county.
in that time, in the county, yeah, at that
Right,
time.
and in fact, that just was finalized in March of this
Right,
year.
yep, you finished paying for it, yep.
Right, it was 100 months at $500 a month, and essentially it was a lease to own sort of arrangement. So again, you know, I think people all wanted to do the right thing, have a presence in the community. So Then in May, we got the notification that we did not have the license to run the clinic there. However, the Department of Health has been, very, very good to work with, because they want to support access to primary care in rural New York. So they said, look, go ahead and do a CON application. We'll work through the process. Don't shut it down, and we'll work through this. This is where it gets a little sticky, and which is why when I met with the mayor, we met at the clinic. The clinic is a modular construction from the 1960s. It was not built to be a health center. There have been many code changes to healthcare clinics since that building was built, but since healthcare services were provided in that building. So we knew there were some challenges, but there's grandfathering that occurs. But grandfathering only works if you have the license, right? So if you have to start over and request the license in 2019, you're held to the current standards. So we brought in a group out of Watertown called BCA. They're an architectural firm who does healthcare. And we said, look, in fact, we expedited it, and they came in very quickly and did a full review. The level of modification that has to occur it's at a level 3, and what that means is more than 50% of the building needs to be modified. That is not a good thing. So we received a very detailed report. I won't read the report to you because we could be here till 9. But the short of it is that if we renovate the current space, it's projected to cost $712,000. Okay. That doesn't make a whole lot of sense when new construction is projected to be between $800,000 and $1 million. So we don't want to throw good money after a bad building. However, for a 2-day-a-week clinic, that is a huge investment. And I use the word investment because that's how I feel about primary care. We have clinics in Lyons Falls, obviously Lowville is the hub, Beaver River, Harrisville, and Copenhagen. And primary care is a financial drain on healthcare institutions. However, there are things that generate revenue for us. So I look at it as we are investing in primary care, and we try to maximize the profit in those service lines that allow us to invest in primary care. And if it all comes together well, I guess it's one of those few times where if you say it's an investment rather than a subsidy, you can keep your commitment to primary care access at the local community level, and that's what we're trying to do. In fact, when I was driving here, I should have brought our annual report for 2018, because we really put a lot of focus on this notion of health and wellness. That's the investment piece. And over time, if you do it right, you can improve the health of your community. So for example, in Lewis County, we have a high colon cancer rate. Well, when you're, as an institution, focusing on health and wellness, just maybe you can make a difference and promote colonoscopies, promote nutrition. You will drive down colon cancer rates. Doesn't happen overnight, but over years you can have that kind of success. So the Board of Managers is very supportive of supporting the investment to have a clinic here in Copenhagen. The question that is not yet resolved is how are we going to do it? Will it be rehabbing the old building, which, my opinion is we should not, or are we building a brand new building? If that's the path we go, we got to try to find some ways to, lower the cost. The third, I received a letter just 2 days ago from the Department of Health. There may be an opportunity for us to kind of go between building a brand new building and the full rehab to all of the current codes. And I have a meeting scheduled next week to work through that. It was 2 days ago I got the letter, so I'm not at a place yet where I can speak thoughtfully about, the cost and the timeline and that sort of thing. The timeline, I can tell you, however, would be the shortest of all of the options. If we were to renovate the current building, go through the certificate of need process, it's just shy of a 2-year process. If we start from scratch, it's probably a little more than 2 years. Just like the conversations you're having with Dollar General, we'd have to go through, you know, the site reviews and all those things I don't know much about. So if we can find this middle of the road place, we could be up and running. We are actively looking to recruit a family nurse practitioner rather than a physician. And frankly, it's because there are more of them than physicians. And right now, overall recruitment to the North Country of physicians is very difficult. We're going through strategic planning for the health system, and I believe recruitment will be our #1 strategic imperative moving forward. We have openings. We could employ another 50 people, okay? And we have good jobs, we have good pay, we have good benefits, but we don't have the depth of skills in the county to meet the needs that we have. And in fact, last night, we had a meeting with BOCES. We're working with them to sponsor an LPN class. And we're gonna be offering scholarships and all that sort of thing. So there are 5 options: rehab, demolish the current structure and rebuild on site. We could return the property to Copenhagen because it was not our intention to get a building and not use it here. We could return the property to Copenhagen and look for a different site, or we could repurpose the building for something other than healthcare. Again, there's no interest in doing that. But when we were brainstorming all of the possible options, those are truly the possible options. I would love to be in the downtown district if we could, but there really isn't a building that would meet our needs. It would require tearing something down and rebuilding. Old buildings don't lend themselves to rehabbing for healthcare purposes. And as you know, the ADA requirements are pretty meaningful, and old buildings did not address, you know, disability access. So the board is committed to being here. We need to work through what are the options. We think the option is leaning more towards some kind of rebuild, or this other option that just came my way 2 days ago. So come back to you in the future as it clears up a little bit. But you know, my hope is as we end our conversation tonight that you get the sense we are committed to Copenhagen. We are the county's healthcare system, and you are one of the major population areas in the county. And you know, we want to work with you to have access to primary care. Do you have any questions of me?
No, I think that was our intention when we sold the building to the hospital initially, was that we would ensure health care for our community. That was the whole purpose of doing that. Because it was at the community, it was owned by somebody else, and it was given to us.
Originally it was owned by the Copenhagen Civic Corporation.
Yes, the Civics Club, there you go, and then it was turned over to the village when they could no longer support it, and we just kind of floated along, and when the doctor decided he wanted to be part of Lewis County, we said, okay, and you know, and that's when we made the commitment to sell them that, and that was, so I guess, I don't know how everybody else feels, but I wanna see that clinic here, you know, it's important.
Yeah, I think it's very important.
So we'll keep you posted.
Sure.
And when there's a meaningful announcement, I'll reach out to Sue to figure out when I can come and visit with you. And in between now and then, if you have any questions, please don't hesitate to give me a call.
Okay.
I gave Ken my contact information. I think I've sent Sue an email along the way, and she has my contact information. I'd much rather have you just call, no matter how big or little the question is, because I think if you hear it straight from the horse's mouth, then, you know, social media and rumor doesn't take over, and I'd rather have it come right from me.
Good.
Okay.
And letting us know what you need from us, that's important.
Okay, terrific. All right, well, thank you for your time.
Thank you.